This is breaking news from Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Communicable Disease Supervisor Haley Blake will also be here, to help answer your questions. At this time, Dr. Love, please begin.
All right, thank you, Corey, and thank you everybody for joining us today. As Corey says, I'm Dr. Portloaf. I serve as the Chief Medical Officer here for the Southern Nevada Health District. Please be joined here by Haley Blake, our Communicable Disease Supervisor, and Missy Robinson, who's one of our Public Health Preparedness Supervisors. So as you are all probably aware, it was just announced that the monkeypox outbreak has been declared a public health emergency in the United States. This means there will be additional federal resources directed towards combating the outbreak. We look forward to working with our federal, state, and local partners to be able to step up our response efforts with the assistance of the public health assets that will be made available to us. I'm also pleased to announce today that we received an additional 2,956 monkeypox vaccine doses this week to make available to people who are currently eligible for the vaccine. However, in addition to offering first doses of the vaccine, we must reserve some of this new vaccine allotment to provide second doses for our clients, as well as to ensure we have vaccine for our disease surveillance and contact investigation activities. Now, the health district is still getting very limited number of doses of vaccines. And unfortunately, at this time, the appointment portal that serves both the Southern Nevada Health District and the Washoe County Health District is experiencing technical difficulties. We have been serving walk-ins today, and we'll do so again tomorrow. And we are also pleased to announce that we are offering a clinic this Saturday. Now, the state is keeping us updated on the status of the vaccination management system, and will let us know as soon as it is operable and the public has access to the appointment system. So until that appointment system is available, we will continue to accept walk-ins. We do appreciate the public's patience at this time. This is a system that is used for all immunization appointments, and our staff is working diligently to meet the needs of all our clients, including those who are coming to our clinics for back-to-school immunizations. Now, the Health District is receiving its allotment of the Jynneos monkeypox vaccine through the U.S. Department of Health and Human Services distribution process. The vaccine is being distributed from the Strategic National Stockpile, or SNS, to jurisdictions in support of our local response efforts. At this time, the Department of Health and Human Services is allocating the vaccine to meet the needs of at-risk individuals and prioritizing those jurisdictions that have been hardest hit by the outbreak. The state of Nevada requests and receives its allocation of the vaccines through this process as determined by the Department of Health and Human Services. I want to assure our community we are requesting the full amount of vaccine we can and making appointments available as soon as the vaccine arrives. Having vaccine is, of course, vital to stopping the outbreak, and we are committed to ensuring we make all our resources accessible to those who need them the most as soon as they are available to us. I also urge everyone to continue to take steps to protect themselves and others. People who have unknown rash or lesions should contact their healthcare provider to be assessed, as they should avoid intimate contact with others until they have been tested. Now, more information about prevention, the vaccine eligibility, and case counts is available on our website at www.snhd.info/monkeypox. We will now open it up to questions.
If anyone in the room would like to ask a question, please use the raise hand feature or type that question into the chat box. Remember, we'll begin with one question from each member of the media. And first up today, I see Shannon Miller. I'm unmuting you now.
Hello, thank you so much for taking my question. So you mentioned 2,956 monkeypox vaccine doses, and that's what we received this week. Can you just give us kind of a relative, does the health district have a number of like how many people we think would potentially need this vaccine should the cases start to break out, as they have in California, for example? Thank you.
Yeah, we don't actually have that number at this time, although I will say that we are trying to prioritize the vaccine to those folks who are at greatest risk for exposure. And these include anybody that might have had direct contact with someone with monkeypox or suspected monkeypox in the last 2 weeks, as well as gay, bisexual, or other men who have sex with men who might have had contact with monkeypox, with a monkeypox case unknowingly.
As we continue to call on people, please identify yourself and your media outlet if you don't mind. Next question is from Lauren. I'm unmuting you now. I'm sorry, Lauren, we can't hear you. I think you're unmuted, but we can't hear you. Let me mute you and unmute you again. Lauren, are you there?
I am. Can you guys hear me now? Is this
Yes, ma'am.
okay? Excellent. Lauren Clark here with Channel 3. Thank you so much for hosting this today. We really appreciate it. Doctor, do you mind speaking to the misconceptions surrounding monkeypox at this time and addressing that for our community?
Dr. Lowe, if you're muted.
Lauren, can you please clarify that question in terms of the misconceptions?
Absolutely. Yeah. Some people believe that this is exclusive to the LGBT community and believe that this is a sexually transmitted disease. Do you mind kind of clarifying that for some people?
Yeah, of course, I can speak to that, and perhaps Haley might be able to add to that as well. So certainly monkeypox, anybody is susceptible to monkeypox. However, in order for people to be infected with monkeypox, they must have a way to get exposed to it. So currently the outbreak in the United States and most of the rest of the world is really largely confined to gay, bisexual, and other men who have sex with men. Now, some of that contact, some of that exposure, if you will, is happening through sexual activity, but it's not a sexually transmitted infection per se. So the transmission is occurring through very intimate kind of contact, which of course can happen through sexual activity, but it's also spreading through other ways as well, such as direct contact, hugging, kissing, massaging, anything where someone may come into intimate contact with another person. That's really how this virus is being transmitted. There's also concerns or threats that it could be spread through respiratory droplets as well, again, but only through very close, intimate, and prolonged contact between people. So again, the outbreak is currently largely confined to gay, bisexual, and other men who have sex with men, but it's not to say that other people are not at risk or not susceptible, if you will, but most people have not yet had that opportunity to be exposed to it. And I'll have Haley jump in to see if she has anything else to say about that.
I don't have anything additional to add. I think you covered everything, Dr. Lowe.
Okay.
Our next question today is from Catalina. I'm unmuting you now.
Hi, good afternoon. Thank you so much for all of your time. My name is Catalina Perez Armenian with Telemundo Las Vegas. And my question is, some states have already declared a state of emergency because of monkeypox. What would determine whether or not we do that here in Nevada? And also, what is the danger for workers that work in hotel just because our tourism industry is so big here?
Misty, you want to take that first part, and I'll be happy to answer the second part.
Sorry, I had to get my mute button off. So the first part of the question, I'm sorry, what was that?
Yes, the first part of the question is some states have already declared a state of emergency because of monkeypox. What would determine whether or not we do that here as well in Nevada?
So what would happen here is that if the number of cases and the number of people needing vaccine outweigh what we can do here locally. So if we needed additional resources, if we needed additional staff to help us with providing this vaccine or providing treatment or providing any type of case investigations, then we would declare a local emergency. And then that would go to our Clark County Office of Emergency Management. And then the governor would determine whether or not there would be a state declaration of emergency. So it starts with the local process first, and then goes up to the state. However, right now we do not foresee any need to declare an emergency, but we are carefully watching the case numbers as they continue to climb and ensure that we have the resources available to provide the vaccine that we have. Thank you.
Yeah, and this is Dr. Loaf, so I'll chime in and answer your second question. I think it had to do with the risk of exposure to hospitality workers, for example, folks that might be cleaning rooms or changing beds and things like that. So it's certainly possible that that towels and bedding and linen and things like that can become contaminated with the monkeypox vaccine if someone were to be infected with monkeypox and say was in a bed or was using towels, things like that. But the risk to hospitality workers for cleaning rooms and changing linens and washing linens and things like that is extremely low. They have good procedures in place currently to protect themselves from those kinds of things. So I wouldn't worry that would be a risk for transmission of the monkeypox.
Next up, we have Christian. I'm unmuting you now.
Good afternoon, everyone. This is Christian with 8 News Now here in Vegas. My question is in terms of getting children protected with the school year, just around the corner. We're seeing that some children across the country are getting monkeypox. Is there any plan to, roll any type of effort to get the kids here protected? Is there any vaccine, any effort in place to get all the kids protected?
Yeah, I can answer that. So the vaccine is currently not available to anybody under 18 years of age. We do recognize that children could be a risk for exposure, and that risk certainly could happen if there is a member of a household that is infected with monkeypox that could transmit it onto their child. But I think the risks there are very minimal. We've only had a couple cases that I'm aware of in the country so far of children that have come down with monkeypox, in compared to the thousands of adults that have come down to it. So I think generally at this time the risk is very low in children. Of course, as we identify cases, we're going to certainly give them instructions for how to prevent transmission to children within households. I think that's probably the most important thing that we can do at this time. And we'll certainly continue to monitor the outbreak to see its potential impact on children in the future.
Next question comes from Jacqueline. I'm unmuting you now.
Good afternoon. A lot of people are concerned about events, concerts, parties where there's packed crowds or a bar. What is the risk of exposure in an environment like that?
Haley, you want to take that one?
Sure, I can take that. The risk of exposure is really, it's very dependent upon the type of setting that a person is going to, how long they're going to be there, and the type of clothing that people are wearing while they are there. So it's difficult to predict without knowing all of those factors.
Yeah, and I'll just add to that certainly we're really looking at kind of direct, intimate kind of contact between individuals. So we do know that in outbreaks in various other parts of the country that gay, bisexual, and other men who have sex with men have been exposed to very direct, intimate contact, perhaps in situations where they might be engaging in sex, or maybe at parties or events like that where they have limited amount of clothing on. So situations where people are clothed, I think the risk is very, very low, but certainly that risk increases the more intimate kind of contact that we have.
Next up, we're going to take a question from Ken. I'm unmuting you now.
And thanks for hosting this, Doc and Haley. Nuts and bolts question. If I missed it earlier, forgive me. How many doses have you administered to date? And how many cases have we had to date? And thanks.
So I can answer the first question in terms of doses administered. So I don't have a count as of right now, but I think probably close to 700 or 800 doses, I believe, through our efforts over the last couple of weeks.
And as far as the number of cases go, as of yesterday's update to the website, we had 24 cases here in Clark County.
Next up, Joe Moeller. I'm unmuting you now. Trying to, hold on. Go ahead, Joe.
All right, yeah, Joe Moeller from Channel 13 KTNV. As people do go out in public, let's say you go to a movie theater or a gym, how long can this virus live on surfaces? Is that something people should be aware of? Wiping down? What sort of caution should people take when they do go out in public?
I don't have the information about the specific surface time on hand with me, but taking the same general precautions that you would for, your standard personal hygiene, hand washing, avoiding things that are obviously soiled, things like that. And then my understanding is a lot of the gyms still have a lot of the COVID protocols in place where they have the additional material to wipe down the equipment prior and after use. So those are all things that would be helpful in this scenario.
Before we circle back to Lauren and Jacqueline for their follow-ups, let's take a question from the chat. Grace DeRocha from the Las Vegas Sun is asking, with Brazil and Spain now reporting deaths from monkeypox, does the county currently have any plans to implement strategies to protect the immunocompromised and those who may experience more severe cases of the illness?
Yeah, I'll take this one. So certainly, there's a number of things that be done for this high-risk population. First of all, we want to really try to stress basic prevention to avoid any sort of situation where they might be exposed to this virus. Secondly, we want to stress the importance of vaccination for this group. So if folks have not yet been vaccinated and meet our criteria, especially those folks who are immunosuppressed either because of, let's say, HIV or through some other immunosuppressive disease, or because they're taking immunosuppressive drugs, or folks that might have some chronic skin condition, we're really trying to stress those folks to get the vaccine as a way to help prevent them from getting infected with this virus. And then thirdly, we now have treatments available for smallpox. So if someone, I'm sorry, not smallpox, monkeypox. if someone were to come down with monkeypox and these folks are considered high risk for complications, we do have treatments available. We have oral medications available through the health district. We also have IV therapies available as well. So that's an added tool, if you will, to help address this outbreak, especially for the most vulnerable populations.
Just a reminder before we go to some follow-ups, if anyone has not yet asked a question and wishes to ask their first question of the day, please use that raised hand feature or type your question in the chat box at this time. I've got 3 follow-ups I want to go through. First up, Lauren.
Hi there. Thank you again, Lauren Clark with Channel 3. My question is, have there been outreach efforts for the vulnerable communities like the LGBT community and others that are most impacted by this?
Yeah, I'll start, and then perhaps I can have Haley chime in as well. So we are in contact with our partners, including folks that provide medical care to this particular community. We're working to make sure that they have appropriate procedures in place to do testing, making sure that they have access to treatments for their patients, and then trying to make a vaccine available for them in the future as well, so they can vaccinate their patients too. So, so we are certainly doing those kinds of efforts, and also just working with our other community partners to just raise awareness on this issue as well.
Next follow-up question is from Jacqueline.
I know what you guys are doing is the hard work, and there's only so much that can be done with the limited supplies. Thankfully, we have more doses, but I have been hearing about people walking up and learning that there's no more vaccine, walking away, or they don't get appointments, they assume there's nothing, and give up, so to speak. How do we help those that are falling through the cracks as supply is slim, who might really need it? We're trying to get the word out regarding walk-ins, but what else can be done at this pivotal point?
Well, I think, most importantly, we do acknowledge the frustration that's out there within the community. And this frustration is largely driven by the fact that we just don't, up until this point, we really haven't had all the vaccine doses that we hope to have to be able to meet the demand that we have. Fortunately, now we're beginning to get in a much different situation where we have an additional almost 3,000 doses of vaccine that came in this week. We expect additional vaccine doses coming in over the next several weeks or months as well. So that those are certainly positive signs. But in terms of addressing your question specifically, I think first of all, our website is probably the best place for folks to go to find out information about the availability of vaccines and to register for an appointment. Now, certainly we have a glitch in the system now, but we're working very diligently to fix that. So I would encourage people to continue to go to our website and see if the registration portal is open, and if so, to schedule an appointment for themselves. If they're not able to schedule an appointment for whatever reason, certainly we are continuing to accommodate walk-ins at our location here. We're doing that Monday through Friday. And as I said, we now are having a clinic this Saturday from 8 to 1, where we'll be accepting walk-ins there as well. So we're doing our best to make the vaccine that we do have available to the community. We also encourage people to talk to their healthcare providers, to their friends. There's a lot of very active conversation on social media within the gay and bisexual community. So certainly look for information on there as well, or talk to your friends and get information. So lots of different ways that people can access information and to get the vaccine.
Your answer largely answered the question that Christian also posted in the chat box, but he wondered if there was a timeline on when the appointment setting website might be back up.
Yeah, we just don't know yet. We're certainly working our IT people are working very closely with our contractor to fix the system. We don't really have a timeline for when that's going to be fixed. But certainly we're continuing to encourage people to go to our website, and once the registration system is fixed, then certainly encourage them to make an appointment for vaccination.
This is Jennifer Sizemore. I just wanted to say that the state has said that they would let us know as soon as it is available. So again, the best thing people can do is to check it frequently, but we will post messages as soon as it is available again. And then the other thing I wanted to stress is that we are accommodating walk-in appointments, but we can only accommodate so many each day. So we would ask for people's patience with that as well. So once we use our resources for the day, there wouldn't be any additional appointments, walk-in appointments available for that day. So again, we just would ask for people to be patient as we work through not having a lot of vaccine resources and as the appointment system is down, but we're committed to keeping people informed on our website, through our social media platforms. So you can look for information there.
Before we get to our closing remarks, we're going to take 2 really quick follow-up questions, and then we'll let everyone close out. In the chat, Shannon is asking if we could please clarify when the appointment website went down.
Jennifer?
I was just trying to think. I believe we were notified on Tuesday, but we did not have a time frame. And again, we still don't. I think we are hearing that it is getting resolved, and we're hoping that it will be available soon, but we don't have a definitive time frame for when that will be. It's impacting both us, I know, and Washoe. But the state has told us that they will let us know as soon as everything is working again. And we will certainly share that information again with our clients and the public as soon as we know it's available. So it will be, people will be able to go to the system and start making appointments when it is, but we'll certainly post that information too.
And now one final follow-up from Jacqueline.
Hi, important question. I hear that it's quite a strong shot and some people are tired after they get it. Any recommendations for how people might feel after a shot and how to prepare?
Yeah, and I would say that, you know, it applies to any vaccine that folks do get. Certainly if they get a little feverish or swelling or redness, and certainly some ibuprofen can help with all of those symptoms. We also encourage people to drink lots of fluids after they get vaccinated, and they can also just move their arm around. If they move their arm around a lot too, that might help with the pain as well. But generally, this is a very well tolerated shot. It doesn't actually go into the muscle; it actually goes in the subcutaneous tissue. So it's not as bad as it's not as painful as some other shots that folks might receive.
Do we have any closing remarks today from Dr. Loaf, Misty, or Haley?
Yeah, I just want to reiterate a couple things about the vaccination. So again, despite our system being down, we've been able to accommodate large numbers of walk-ins the last couple of days, and we'll continue to accommodate walk-ins tomorrow. We're very pleased to be able to announce that we put together a Saturday clinic. We hope to do a few hundred doses of vaccine there. And despite the challenges with our registration system, we're going to be able to accommodate walk-ins. So we're really happy to make that service available to our community. We'll continue to offer host clinics next week as well. So continue to encourage people to look at our website for future clinics and to make appointments as well.
I just wanted to add, if people are coming in for the shots here, just remember that the monkeypox shots are being given in our COVID vaccine clinic, which is in an external white structure on the south end of our property off of Meadows Lane. All other shots, such as like back to school, is going through the main entrance. So this will save a little time if people just want to walk around to this side. And check out our website, snhd.info/monkeypox, where we will keep our case count, and there's a link to the appointment system for when it comes back up. Thank you all for joining us today, and we'll see you soon. Have a great afternoon.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.